Dr. Steve Ondersma is an associate professor in the Department of Psychiatry and Behavioral Neurosciences in the Wayne State University School of Medicine. He is also a member of the Motivational Interviewing Network of trainers. Hello and welcome. In this video, he speaks briefly about what motivational interviewing is, why you might consider using it, and how you can learn more about it. So what is motivational interviewing?
At its most basic, motivational interviewing is really just a productive way of having a conversation about change with someone. Usually it's going to be about substance abuse. That's the area in which it first developed. It's since then been applied to really all manner of behavior change like medication adherence, treatment adherence, diet, exercise, really any health-related behavior. That's the simple answer, and that's the most basic way to think about it. The more formal definition is that motivational interviewing is a client-centered, directive method of enhancing intrinsic motivation to change by helping somebody to explore and resolve ambivalence. Now that's a definition that could put you to sleep right away almost. I'm going to break it down and hopefully make it make a little bit more sense. The first part is that motivational interviewing is client-centered. That means that at its heart, it's designed to embody things like empathy, optimism, unconditional positive regard, genuineness, okay? All the things that Rogers, if you think back to what you might know about Rogerian psychotherapy or the humanistic school of thought, all those things that Carl Rogers said were so important. It turns out that in the huge literature on whether psychotherapy actually helps people to change and whether one psychotherapy is better than another, that the differences between different therapy types, while they're certainly there, are relatively small, and that the differences between therapists are at least as large, such that any given therapist, whatever the approach they're using, is going to have better results if they're embodying those sorts of characteristics like the empathy and the optimism and that unconditional positive regard. So while most psychotherapies are built around the techniques, motivational interviewing, while it certainly has techniques within it, is at its heart built around that client-centered core. You can't do good motivational interviewing, no matter how strategic and clever you are, if you're not embodying that empathy and that optimism and that warmth with your client. Okay? So that's the first part of that definition, is that it's client-centered. The second part is that it's directive, and this is really different than traditional client-centered therapy. Client-centered therapy, in theory, was all about wherever the client wanted to go. Wherever that patient was going, you were simply following them. Okay? With motivational interviewing, you're extremely focused, like a laser beam, on one specific question, and that question is whether or not the person is ready to consider changing right now. And that's it. So for example, in most cases it might be about whether or not to reduce or quit alcohol use. And that's the whole conversation. It is centered around that. Other things come up, they all get redirected back to that core question, to that target behavior. Alcohol use, drug use, medication adherence, what have you. Okay? And that makes it very different from traditional client-centered therapy. That third piece, so enhancing intrinsic motivation to change. Motivational interviewing is the only evidence-based approach out there that is about whether or not the patient wants to change in the first place. Every other approach is about how to change. It presumes that the patient or client wants to make some change and has wonderful strategies like cognitive behavioral therapy or interpersonal therapy about how to make that change happen. Motivational interviewing is more taking a step back and saying, are you ready to make a change in this? And if so, why? Right? The second thing that's really different about it is that it presumes that your ability to make that change could very well be sufficient in order to make that change happen. 75% of people who do get over an alcohol or drug use disorder do so on their own, without any professional help and without using 12-step groups. Okay? Now, it's not easy. They have to try over and over again many times. But what this means is that your own internal resources, and this is a big core belief for motivational interviewing, the internal resources of the person you're working with could very well be sufficient as long as they're sufficiently motivated to make that change. Okay? And in doing that, another factor that's really different about motivational interviewing is that you're not trying to give them the reasons to make that change. Okay? In motivational interviewing, rather than saying you should change because of this or because of this or because of this, you're saying, why might you want to make some change? You're trying to elicit those reasons from the patient, because it's those reasons that come from the patient that are far more powerful. Okay? And that gets us to that last piece of the definition, by exploring and resolving ambivalence. This really refers to the fact that there are two key things about ambivalence that are extremely important. One is that when we're ambivalent about something, and by definition, folks with substance use disorders, for example, are ambivalent in that it's something that they do quite a bit, but it's also something that's harming them, okay? Or it doesn't meet the criteria. That when they're ambivalent about something and you present one side of it, they're almost by default going to present the other side. Okay? So for example, if you're feeling ambivalent about alcohol use, and I begin urging you to change and giving you reasons to change, I very well might cause you to come up with arguments against change. And that's the opposite of what I want to do. What I want to do instead is to elicit reasons to change from you because, and this is the second important thing about ambivalence, because we believe what we say. This means that if I manage to pull from you reasons to change, I'm helping to make you more likely to change. And if I manage to pull from you reasons not to change, I could very well be making you less likely to change, and we don't want to do that.
Thank you, Dr. Ondersma. Click on the other links of this website to check out more information on motivational interviewing and therapeutic approaches.